Welcome to this on-demand video where we will be reviewing information gathering to complete the CANS and look at some of the child mental health items. For any SACWIS CANS concerns, please reach out to Rob Herquest. He can be contacted at dcfs.cansuse@illinois.gov or robert.herquest@northwestern.edu. You may not always have the opportunity to meet with the parents or the children on the cases that you are serving. In this case, you would be using information integration and collaboration to be able to gather information to complete your CANS. When scoring the CANS, consider any and all sources of information that can provide insight on the youth. Don't forget to consider services the youth received prior to case opening, such as therapists, hospitalizations, mentors, favorite teachers, etc. Even if there is no father figure in the child's life, don't forget to get the paternal family as a source of information. Don't forget about files you have access to. Some of these may include school files, IEPs, behavioral treatment plans, functional behavioral assessment, previously completed CANS, and other sources you might have access to. According to iData Assist, data mining is a technique that sees a lot of use in the corporate and technology sectors, but it also has the potential to be very valuable to those of us in the social sector. An example would be when reviewing a file, you learn that an older youth has a history of special education and an IEP. This information did not arise during any of your interviews, as they do not currently have an IEP and has not had one for several years. Based on this information, you might want to contact the youth school or ask additional questions of the family. We will now review the child mental health domains. These include traumatic stress symptoms, 14 through 19, life domain functioning, 31 through 43, behavioral emotional needs, 48 through 60, and child risk behaviors, 61 through 71. Traumatic stress symptoms. These ratings describe a range of reactions that a child may exhibit due to any traumatic experience. This domain includes adjustment to trauma, traumatic grief separation, re-experiencing, avoidance, numbing, and dissociation. Remember, unlike traumatic experiences that are lifetime and cumulative, these reactions are rated on the past 30 days or most current information you have. Are parents telling you that a child is having nightmares about a traumatic event? Are there any therapist notes about repetitive play with themes of a traumatic experience? Does a teacher tell you the child is daydreaming in class after experiencing a traumatic event? These may be all clues to help you understand that you need to look further into the traumatic stress symptoms. Life domain functioning. These ratings describe how a child is doing in their various environments or life domains. This domain includes family, living situation, social functioning, developmental intellectual, recreational, legal, medical, physical, sleep, sexual development, school behavior, school achievement, and school attendance. Remember that number 31, family, is looking at how well the child is getting along with their family members. Number 32 is not about where they are living, but rather how they are functioning within their living situation. A note to make about item number 36, legal. After Northwestern University's monthly data download, all CANs are submitted from previous months and are searched for a 2 or 3 score. For all youth that have a score of 2 or 3 on the legal item, Northwestern University generates a report for the CCN agency. CCN then looks at the list and attempts to see if any youth is also involved in the juvenile justice system. This is a great example of data mining. Some examples of questions you may ask while looking at the life domain functioning domain would be, are parents telling you that a child is arguing with other family members in the home or having difficulty interacting with others in the home? Is the child currently on probation? Does a teacher or school counselor tell you the child is being disruptive in class? Does the child's school attendance record indicate a concern? Does the child have an IEP? Child behavioral emotional needs. These ratings identify the behavioral health needs of the child. A DSM diagnosis is consistent with a rating of 2 or 3. This domain includes the following items: psychosis, attention deficit impulse control, depression, anxiety, oppositional behavior, conduct, substance abuse, attachment difficulties, eating disturbances, affect dysregulation, behavioral regression, somatization, and anger control. It is important to note that oppositional behavior is about non-compliance with authority rather than inflicting damage or hurting others. Conduct is antisocial behavior. Examples include shoplifting, lying, vandalism, cruelty to animals, and assault. Examples of questions you may ask when looking at the child behavioral emotional needs domain would be, has a therapist left a note about signs of depression or anxiety? Is the child struggling in school with compliance with rules or school authority? Does a parent tell you that a child has difficulties modulating their emotions? Child risk behaviors. Risk behaviors are the types of things that can get children in trouble or put them in danger of hurting themselves or others. Note, timeframes for these items move away from that standard 30-day window. Items in the child risk domain include suicide risk, self-mutilation, other self-harm, danger to others, sexual aggression, runaway, delinquency, judgment, fire setting, social behavior, and sexually reactive behaviors. Please note that social behavior, item number 70, is about intentional, obnoxious behaviors seeking sanctions. The information gathered from case files and previous CANs can be an excellent source, but it is important to look at it through a lens of potential bias. There are 5 different types of bias. Cognitive bias, which is a deviation from standards of judgment. A person may create inferences, assessments, or perceptions that are unreasonable. There could be a recollection of past experiences that are incorrect. Prejudice, which are prejudgments or prior opinions that a person makes before they are given the relevant facts and information. Often, these are based on factors such as race, religion, gender, sexual orientation, age, disability, social class, or language. Contextual bias. This is when experts who have good intentions are vulnerable to making incorrect decisions based on external influences or influences that are irrelevant or unrelated to the situation. Racial profiling and victim blaming are both examples of common contextual biases. Unconscious or implicit bias. Implicit stereotypes and when a person unconsciously attributes certain qualities to a certain social group. And statistical bias. This is related to the process of data collection. Examples include forecast bias, observer expectancy effect, selection bias, reporting bias, and social desirability bias. For more information about scoring bias, Please review the scoring bias on-demand video. The next slides will look at some examples. An intact family becomes DCFS involved after an episode of family violence. The child witnesses the episode and their mother tells you that they are now having nightmares related to that episode. How would you score number 14, adjustment to trauma? 2. Child has marked adjustment problems associated with traumatic experiences. Child may have nightmares or other notable symptoms of adjustment difficulties. A child's school tells you that they have concerns with the child's behavior. The child is frequently being sent down to the office for disruptive behaviors and that they are in jeopardy of being expelled. How would you rate number 41, school behavior? 2. Child is having moderate behavioral difficulties at school. They are frequently or severely disruptive. School placement may be in jeopardy due to behavior. Medical records indicate that a child has diabetes and must take insulin. How would you score 37 medical? 2. Child has chronic illness that requires ongoing medical intervention. You see in a child's records that they are currently on probation for assault. How would you score 36 legal? 2. Child has some legal problems, is currently involved in the legal system, and may have active parole and/or probation mandates. A child's therapist has diagnosed them with ADHD. How would you score 49 attention deficit impulse control? 2. This rating is used to indicate a child with moderate symptoms of attention hyperactivity or impulse control problems. A child who meets DSM-4 diagnostic criteria for ADHD would be rated here. A school nurse tells you that a child has been to see her several times recently, complaining of a headache. These headaches always seem to coincide with a test day at school. How would you score 59 somatization? 1. This rating indicates a child with a mild level of somatic problems. This could include occasional headaches, stomach problems, joint, limb, or chest pain without medical cause. After speaking with a youth's high school football coach, you learn that there's been a concern about the youth losing their temper and increased verbal outbursts during practice, and they are in jeopardy of being removed from the team. How would you score number 60, anger control? 2. Moderate anger control problems. Their temper has gotten them in significant trouble, may be associated with some increased verbal outbursts. How would you score 68 judgment for a youth after their parent confides in you that they are concerned about the child's new friends who often get into trouble? 1. History of problems with judgment in which the child makes decisions that are in some way harmful. Remember, 1 is watchful waiting or caution. A school counselor tells you that the child often is extremely disruptive in class right before a test. How would you score number 70, social behavior? 2. Moderate level of problematic social behavior. Child may be intentionally getting in trouble in school or at home, and the sanctions or threat of sanctions that result are causing problems in the child's life. The child is intentionally acting out, seeking sanctions. Thank you. If you have any further questions or concerns, please reach out to Shannon Kroll, Emma Breen, or Robert Herquest.